Hey, welcome in, everybody. It's Tim Brown, your host for Pharmcast for the Community, sponsored by University of Georgia's College of Pharmacy. We took the summer off to get a little breather. The students are back. We're chugging right along, and we're going to kick off this academic year by having Dr. Patrick Chancy join us. I'm going to talk a little bit about what we're doing with regard to this particular episode because it's different. Normally, I try to bring on something that's disease states and try to help you manage your health, those kinds of things. But recently, there has been so much in the media about drug pricing. The cost of drugs have gone up dramatically. As a matter of fact, statistics show that we in America pay probably 2.5 times what other people in the world pay for the exact same drugs. And one of the biggest advocates we have as consumers are our pharmacists who help us navigate this system. And Dr. Chancy, who is actually the clinical science director for Chancy Drugs, is also a co-founder of Continuum Health Solutions, which is a company that focuses on putting pharmacists in physicians' offices. I don't think I have to explain to many people that when a physician prescribes a product, having a pharmacist nearby is a huge resource to help them figure out the best product, the best medicine, but also sometimes the medicine that fits in the budget of that patient, so they can actually take something that works for their diabetes, for example, but they can actually get to because it's affordable. He also serves on the CPESN USA Board of Managers and also the CPESN Georgia Board of Directors. I know that his family has a deep history with pharmacy, and he is one of our alumni, and we love having him on at all times. Hey, Dr. Chancy, how you doing?
Doing great, Tim. Thanks for having me on. Excited to be here.
I enjoy it when you come on. You always teach me so much. And when I reached out to you about this topic, did I surprise you that I was reaching out about drug pricing at all with everything that I know you go through daily?
I was about to say, it sounds like the typical conversation I get to have, so we should be just fine.
Now, can you tell us a little bit about, I did a background on you, obviously, but what does all that mean? What do you do day to day within pharmacy?
The nice thing is the day-to-day varies. We have multiple locations down in South Georgia. And so we've got a large team that we're excited about to be able to impact our community. Just expanded to another pharmacy not too long ago, and so our reach is expanding. But also too, that means there's a lot of lives that we get to touch. So my job is to really make sure that we have all the cutting edge information and to have the relationships in the community to make sure that we're treating our community the best way that we know how, and some of the things that we're doing with Continuum are starting to branch into primary care and learn more about how do our providers provide that care, and where can pharmacists play a role that maybe has not been thought of, especially in our area. Some people are doing it well, and so we're trying to expand that. And so it all fits into the conversation that we're trying to have today.
Well, it's interesting because you know that I came from Ohio, where for about 26 years I was in practice with a group of physicians embedded in the office, seeing patients that need a little bit of help. But to your point about that, it was that point of contact with a physician to say, I think this might be your best option, or I'm a little concerned because this drug costs $1,000 and I'm not so sure that's affordable for a lot of people. You see a large number of people come through your pharmacies on a daily basis. Can I just ask, how many prescriptions are you filling across the entire aspect of Chancy Drugs? How many prescriptions do you fill in a single day?
Oh, good gracious. Well, we average, depending on the location, we're averaging from anywhere from 200 to 500 or 600 a day per location. It kind of, like I say, on average. So when you start to do the math, we're now at 7 locations. So numbers start to add up relatively quickly. And with the number of drugs starting to, the cost of these drugs starting to go up, the amount that it's costing just to purchase these meds, it's starting to change how we operate.
I can't even imagine. So as a pharmacist and a technician, you're filling between 200 and 500 prescriptions a day. My guess will be over the course of that, you have a lot of questions that do come in of, why is it so expensive? Or isn't there something cheaper? Do you have a lot of, sometimes I think you might get that question more than, what does this drug do?
Without a doubt. And sometimes they at that point, when they hear what their copay might be, sometimes they don't care what it does. And so it really a lot of our job is about navigating this world. Anybody on here that's listening that has worked in the retail space, they get this all the time. So having, especially with Medicare Part D, and understanding how deductibles work, how the premiums work, what are copays, what's the donut hole, how do it was my copay was lower at the end of the year. Why is it high at the beginning of the year? You have a lot of conversations to navigate that we don't always get in school. I think school does prepare us for the broad strokes, but sometimes until you get to put your hands on it and experience what these conversations are like and what these people are truly going through,
Yeah.
until you get to put yourself in their shoes, it doesn't make sense, and it requires that knowledge of the patient and that relationship to be able to navigate, because we're having those conversations on a minute by minute basis, and sometimes multiple sometimes that conversation might happen on multiple drugs with the same patient at one time. So it can get, especially with these common disease states such as diabetes. I mean, the cost of these drugs is getting pretty astronomical.
You mentioned the word copay. How are copays decided? Because for example, if you and I go in and get the exact same drug, my copay can be different than yours. Why is it? It seems like if the drug is the exact same cost, why do I have to pay more, but the other person has a copay that's $10? Why is that?
So it varies based on insurance. And so with us, whether you're using your employer's insurance, or if you have state Medicaid, or if you have a Part D plan, or it could be a regular Part D plan, and then you may have a Medicare Advantage plan. So there's commercial payers, and so everyone kind of dictates that a little bit differently. We have some relationships with local employers that are self-insured, and we can actually have conversations with them about what their copays are. And so, but that's few and far between because of that relationship, but that does not happen very often.
Got it.
But these large forwards, like you're looking at your top 5 or 10 companies in terms of revenue in the world, are the ones that are deciding what copays are on certain medications, and how that's being and there's a lot of things like NADAC pricing and things that go into how they're deciding these numbers, but it's a lot of smoke and mirrors to get to what the actual answer is on why your copay is what it is. And a lot of times you can call the insurance company and they don't even know how to tell you why that's the actual copay for the med.
So, if you're the patient or the customer and you've got a new drug that's coming in, is it worth calling ahead to sort of say, what's my copay going to be on this one? Or how would you sort of prepare someone to say, this isn't going to work, I need to call my provider back, versus getting to the store and having to sit there or not get the medication? Do you encourage people to call and ask, or is there a way they can check how much it's going to be without necessarily having to talk to the pharmacist?
So a lot of times, depending on the pharmacy, and I know we have this set up, and so you've got your larger retail chains and things of that nature may have like an app or something like that you can go in and look at your profile and see what the copays are.
Got it.
Ahead of time. But I know for us, when we're actually in the process of preparing a prescription, if we see a copay that's crazy out of line, we like to go ahead and call the patient. So if you've got somebody on here that if anybody's listening and you're a part of the process of preparing a prescription for a patient, and you're seeing some kind of outlandish copays, we like to check and make sure, did we do everything right on our end? Is everything showing up the right way?
I see.
And then trying to get ahead of it, and then calling a patient and saying, hey, we've talked to the insurance company, we've made sure that we've billed this properly. This is what's coming back as a copay. And then also too, it may be something that the doctor's office, the drug rep may have just come by and they know it's a really good option, but it's a brand new brand medication that's super expensive, and that doctor knows this will be a good option for the patient. Well, their insurance either doesn't cover it or wants 3 prior approvals before it even gets to the patient. So the copays might be high at that point.
Got it.
So we try to help them navigate that.
So, navigating that, I guess, we're talking about insurances and copays and those kinds of things. And I'll get to Medicare D in a second, because it's a whole different animal. I mean, it is. But when you're talking about copays and something being higher or lower, there are also programs that pharmacists can talk to you about, right? I mean, there's coupon codes, there are things that you can, it's sad to say this, that you almost have to sort of bargain shop a little bit. But do you find that we as pharmacists are educating the public, or did the public come in and go, I signed up for this program? Is that really well known among people who come in?
So a lot of times you'll get your big names like your GoodRx and things like that on patients that will come in and things that they've seen on TV and sign up for. GoodRx is its own conversation in general,
Yeah.
but there are coupon codes and things of that nature that we do have to be ready for to have an understanding of how they work. So a lot of your brand medications will typically have a coupon code or something to try to at least get that first year of coverage to help with managing that. And usually what that's heading off is maybe sometimes insurance is catching up with a new drug and they're needing to learn how they want to cover this medication. And so for us, we do have to kind of bargain hunt and then make sure that we're helping the patient find the best option and make sure that that therapy might be the best option. It might be the best option, but for the cost, is it truly the best option and getting enough bang for our buck? And because unfortunately, like you say, that's where we're at, and that's what we have to navigate. So there are multiple options in trying to figure that out. There's never just one solution, or there's never only just one option.
Not with drug pricing. So I'm gonna go back to my other. I said earlier, if I want to find out what my copay is, how do I do that? If I want to know if there's a coupon or a card or something I can give to my pharmacist that might help decrease my copay, they should do that before they come to see you, right? And have that ready to go. Is that easier for you as a pharmacist, or does it make the process easier? I guess is a better way to say it.
So it never hurts if you want to provide something to your pharmacy a lot, because everybody goes to Dr. Google and they're going to type it in and try to figure out what needs to happen. And so if there is something, you can always bring it. And sometimes a doctor, especially if it's a new medication, the doctor sometimes will get a coupon card from a drug rep, and it will help cover the cost of that medication, at least in the short term. So a lot of times people will present us with something that they received from their doctor or something that they saw online, or maybe they saw a commercial and they talked about it. So we always welcome that information, but we like to, we typically will go out searching for that as well. Whenever we see a particularly high copay, we'll like to check and see if there's an option for the patient to try to get that taken care of.
Yeah, I want people who are listening to sort of understand that before you go pick up your script, there's some homework you can do. One is figure out how much is going to be out of your pocket. And the second, to your point earlier, is it something I truly, truly need, or is there a better option that's more affordable? And then lastly, if that is the option, make sure that you're looking for all the ways you can get your copay knocked down. It's interesting. I just had a very expensive drug prescribed for me, and it kind of scared me. And I was waiting for them to call to let me know if it would go through insurance. And when they called, they told me my copay and said, but don't worry, we found this program for you. We've signed you up and you qualify. So my pharmacist did that for me to lower my copay to nothing, to actually zero. And so I want people to understand that these are questions you should be asking as a consumer. Don't take that as face value, that pharmacists are there to help you. And as you point out, physicians' offices are really stepping up and try to work with people as well. We've talked a little bit about traditional insurance, the copay card and how those are kind of decided, but also how to be a savvy consumer. Whenever you reach the age of 65, you morph into this little system called Medicare D. And Medicare D feels like a regular insurance plan, but it wasn't until I had to help my dad choose his plan did I realize how crazy that can be. Do you have any advice for people of how they can choose their Medicare D plans, like what things they should look for so they can get the best bang for their buck, if you will?
So you're opening a can of worms here, and Medicare Part D looks, to your point, looks like regular insurance until it doesn't.
Yeah.
And it doesn't take long for that to happen. And it does provide a lot of benefit for folks, but it is a complicated world. And so if you go onto any TV channel, I like to always use Joe Namath as the example. You're always going to see Joe Namath on a commercial and talking about a Medicare plan and things like that. So
I remember that.
There's see, and you remember that too. You don't know what it's about, but it's Medicare, and so I recommend, especially if you or a loved one is navigating that. Joe Namath's probably a great guy. He went to Alabama, so we'll that's neither here nor there for this conversation. But we don't need to trust Joe Namath on this topic. He doesn't know what you need to take care of you or your family member when it comes to navigating the world of Medicare. And so I really think the best thing you can do, and I'm kind of biased, but you need to approach a pharmacy that has experience in navigating the world of Medicare, because what happens is when you call some of these insurance companies, they tell you that when you call said insurance company, they're going to tell you that they're the best plan for you.
Yeah.
They don't really know what you're taking and how you need to be taken care of. You really need a third party to step in and be able to help you navigate that. And there are insurance agents and brokers that can help do that. But I'll just be very honest, in our experience and being on the other side of it, these people get taken advantage of. I had a patient not too long ago that changed their insurance, and this was in the health insurance side, but he told me that he lost some of his coverage because he went to a meeting that he heard about at Red Lobster, and they changed his insurance on him. He signed up for something he didn't even know he signed up for.
Oh,
but
wow.
he had a meeting where he was brought in and a bunch of other folks. This was not a small meeting, but he saw an ad that say get $0 copays and all this kind of stuff, and you show up, and as soon as you say yes to anything, they sign you up for whatever they can. And so going to this is a long-winded answer, but I truly think the best option is going. Hopefully your pharmacy can help you with navigating that, because Medicare.gov, actually you can take your medications or a family member's medications, put them into the system, and it will give you a lot of information back, but it's still very difficult to understand what that information is. And so you really need somebody that has a lot of experience.
You bring up a very good point. I think, talking to folks and me having to go through this, and my brother really being the person that waded through all the information, we put medications in and it sort of narrowed down the choices. And then we looked how much it was per month, and then also what the copays were, and figured out the cheaper plan wasn't going to work because the copays were astronomical. Pay a little bit more per month, and that moved his copays down a lot. And then we had to call primary care and say, listen, this drug's not the preferred drug. Can he move to this drug? So we did that, and it took us probably 2 or 3 months to do all that. And it's glad to hear that pharmacists help with that too. Obviously, he is a father to a pharmacist and engineer, two of the most OCD people on the planet. But also, if I'm not mistaken, AARP runs classes to help you choose plans as well, and they work with pharmacists. Is that a good resource in your opinion?
Absolutely. And there's a lot of good resources like that out there. I think what you have to watch is making sure that whoever you're interacting with, are they getting a benefit on the backside of getting you to do that? And so I think, and sometimes that's hard to know. Yeah. And so I think it's important to use someone local that you have a relationship with, that whether that's your pharmacist or whether it's an insurance insurance broker that health insurance, they can help you navigate that world. But there are a lot of resources, and you need to be educated. Whether you understand it completely or not, you still need to know what you're signing up for, because this is such a big deal that this can be a life changer. Because just think, if you sign up for the wrong plan, unless you are a dual eligible patient or you fit that criteria that you have Medicare and Medicaid, you can't sign up for another 12 months.
You're done. You've got a contract almost. It's interesting you say that like that, because that's exactly sort of our fear when we clicked the button to submit. But one of the things that our family did was we made sure multiple eyes looked at it. Like all of us came in and so I think for people listening, if you've got a grandkid or a kid or, just someone that's there to talk it through. Also, I will say, in the office I moved from, we used to have people in the office where they would bring the thing in and we would have them meet with patients and say, this one looks good to you, especially as we got closer to the year for sign up. Mm-hmm. You mentioned this earlier, and the reason that we did it is because a lot of our patients were in what we call the donut hole starting about October. Can you explain what this term donut hole means? Because it sounds all nice, like the donut hole, yay. It's actually quite horrible.
Yeah. Well, and the way Medicare works is, and this number changes from year to year, but basically what the bottom line is every Medicare patient, every typical Medicare patient, if you're covered by Medicare Part D or an Advantage plan, typically like say Part D, Medicare is going to cover a certain dollar amount of your medications over the course of the year. You may have a deductible at the beginning of the year to get the coverage started, but Medicare is going to be responsible for a certain dollar amount. Now, depending on what medications you're taking, if you're on like say you're on a brand medication, maybe an insulin or one of these GLP-1s, like so these Ozempics or things like that you're hearing about.
Yeah.
Whenever you're taking one of those, those medications are in some situations thousands of dollars a month.
Yeah.
You burn through that amount on Medicare very quickly. And so basically what Medicare says is we're going to cover a large percentage and with a certain dollar amount. But once that is out, you're what's called the donut hole. And then the percentages change drastically in terms of what you are responsible for.
I see.
So Medicare covers a larger amount after you've hit that dollar amount. And so that's why people say, well, people will get confused every year at the beginning of the year, because then you have that high deductible. And then once you get the deductible paid off, then the copays look the same. And then we have some people that hit it in April because they're on so many expensive medications.
Yeah.
But you're right, about October, usually you see a large swath in the early summer, and then people around October will, and toward the end of the year, that's when you'll kind of get two rounds of people hitting the donut hole because of how many medications they're taking. So basically what that means is your copays jump up dramatically, and it can be overwhelming for a lot of folks.
Yeah, because who budgets for that increase, right? Because you think, oh, my medications are going to be this much money. It's what I've spent for the last 4 months. I think the way I think of it, you're on a drug budget. And we talked about copays earlier. This is why it's important that you seek out the cheapest way to get your drugs, even though your insurance covers it. In the back end, it saves you from dropping into that 1 or 2 months where you're paying out of pocket. Or worse yet, I've had people just not get their drugs because they simply couldn't afford them for November and December. And that takes away all the good things that you did the other 10 months of the year, taking your medications. So the donut hole scares me a little bit because it sneaks up on people. And they should be aware of, to your point, how much is coverage, how much are they spending per month? They need to budget a little bit. And that's honestly, Patrick, that's so hard. If you're not someone with this advanced college degree and you're just trying to figure out how to make it work, is it reasonable for them to say, you know what, I don't get this. I'm going to take it to my local pharmacist or pharmacy and say, can you guys help me with this? Is that a reasonable request from our customers to come in and say that?
I believe so, and I think we try to help our patients navigate that. And we're actually having conversations now because open enrollment is on its way, and It will be here very soon, in less than a month. And so, actually, from when we're recording this, a month to the day, and so we have to be prepared to help people navigate that conversation, because even when, to your point earlier, just punching these numbers into Medicare.gov, you're getting a lot of information back, but that's not the end all be all. No. There's so many ways to navigate it, and you have to understand when are you going to hit the donut hole. And sometimes, so like for us, we actually have a different service that we use that helps us do that process faster. So we have, especially if the patient is using us, we can tend to have that conversation relatively quickly. And we try to have staff members that are trained and on board to be able to navigate that. But I do think it's worth talking to your pharmacist and to your local pharmacist and see if they can help you navigate that conversation, or get you connected to somebody that they trust to be able to help educate you.
Yeah, sort of a third party. For those that are in the donut hole right now and you're listening to this, obviously you need to plan for next year and make sure it doesn't happen again. But what if someone's in the donut hole? And I will tell you, I've had people start January and everything looks great. They've done all their homework, they've done everything, and all of a sudden in July, we decide to add the brand new diabetes drug because it has weight loss associated with it, and the copay is $200 a month. And patient's like, okay, I can handle that. What we didn't think of is now we've exhausted that budget we talked about even quicker. So there are some people who've done all their homework correctly, but they still hit the donut hole. What can we do to bridge them from that time all the way to their insurance starts again in January? Are there any programs out there or things that people should be looking for?
So it gets a little hairy once you're in Medicare, because a lot of these coupon programs do not qualify. So how you were talking about earlier, you qualified for that coupon service. That once you're signed up for a government program, a lot of times you'll see the asterisk and you'll see at the bottom what the footnote is for some of that. And a lot of times you'll see on there Medicare does not cover, or once you're in a government program, it's hard for you to get. We're not going to be able to use this coupon, but there are options out there, and sometimes it may be that we need to do a different therapy and something that's a little more cost effective, and to at least get us to where we can have the conversation with the prescriber to say, okay, what are our options here? Because that situation that you just brought up, that's the most common thing that we hear. And so sometimes it might be that you need to have a conversation with your provider to understand, because a lot of times what happens with a lot of people, it's on brand medications, and you see it a lot, especially in like diabetes and maybe COPD with some of these inhalers.
Inhalers, yeah.
The brand, any kind of brand product you're on, and ask your pharmacist what brand products you're on, and they can help you navigate that. But talking to your provider and saying, because you might think, well, I'm not on any diabetes medication, I'm good. Well, what your provider might be watching is you might be well on your way to diabetes, and maybe they, at your next checkup, they say, well, I want to add this medication on board, and or maybe you have diabetes, you're like, well, I'm on these cheap generics that are not that expensive. Well, maybe we're adding an insulin on board, and like I say, insulin, unfortunately, we've helped with some of our coverage there, but maybe we want to try some of these oral brand meds, and so it can change in a hurry. So sometimes having that conversation with your doctor saying, hey, is there a risk of me going and needing new medications that you could foresee that might be a little more expensive, because I'm concerned about that. And like I say, your pharmacist can help you with that as well. And so it's being educated, to your point earlier, asking your team, your healthcare team that's around you, what are my options?
I like that. I think the other thing that you bring up, a very good point, is looking at your medication list, being aware of what we call a brand name versus generic, what's new versus what's not new. But you mentioned something else in there. Sometimes going cheap is not always the best. I understand why we do it, but we keep picking on diabetes drugs. I don't really mean to, but we know there are certain drugs to use for certain things that make you live longer. They're newer. We know they're out there. Statins, atorvastatin, simvastatin, they're now more affordable, but we've known for years that if you take that medication and you've had a heart attack, it actually stops your second heart attack from happening at a much higher rate than if you're not on it. So, I guess the other question I have is, when we're talking to physicians, nurse practitioners, PAs, is trying to figure out how to keep that optimal therapy going during the donut hole. Do people still have samples that they can help people with, or should people be bashful about asking about that with their providers?
I'll always ask. And sometimes the provider will say, absolutely, we got a closet full of it, or they may know of ways to procure it, and something to help people in navigating that time, because having worked, like say, being present in some of these physicians' offices now, we get to see a little more of that, and are watching that transpire.
Right.
And so that helps us on the pharmacy side as well understand what's taking place in these clinics, and what conversations are being had. And so and a lot of times too, and for people that are listening, the goal, to your point, some of these brand medications are the best option.
Yeah.
And there's nothing like them. But for a lot of people, some of these cheap generics, and being adherent to these medications and taking them like your doctor prescribes, not every other day, not 4 days a week, being adherent to these medications can prevent, and following doctor's orders can keep you from needing to get to some of these medications. And so I think it's important to make sure, is our therapy optimized the way that we think it is? Because a lot of times what we realize and what we run into, and I could go on a rabbit hole about this, but what we run into is a doctor will see a high blood pressure. Well, then they prescribe another medication or increase the dose. Well, if they don't talk to us, or the patient might fib a little bit, or they just haven't realized it, they might not have been taking the medication properly. Yeah. And so they come in and have a high blood pressure, and then all of a sudden they're on multiple medications that they really don't need to be on.
Yeah.
And so, or are they using it right? So that's why the pharmacist needs to be engaged and involved, to make sure, to helping with coaching and counseling through these medications, and then also working with the doctor to make sure that the proper therapy is in place, and that we know what's the end goal here with these medications that we're taking.
It's so funny you bring this up, Patrick, because one of the things that I did working with physicians is they would refer people to me who could not get under control. And sitting down with them for a little while, you realize that about 20%, maybe 25% of the people that I was seeing, they weren't under control because either the medication cost too much, it gave them side effects they didn't like, they were trying to stretch it out over time because they had a bill they didn't realize. And so for people listening to out there, I understand all those rationale. Share those. Don't be embarrassed about any of that. Talk and let people know, because there might be alternate ways to get you another medication that's going to work better for you. I do a lecture here with our first years, and I discuss somebody playing golf and he doesn't take his water pill on the days he plays golf. And everybody goes, why does that matter? And I go, well, it's why his heart is not doing so well. And to your point, you make a very good point that taking your medications and talking with your healthcare providers may help minimize how much you have to pay out of pocket for your drugs, because we may be able to keep things from happening later on. That's a wonderful point. I think the other thing that comes up, and you said it multiple times, and I've sort of alluded to it, there's this big discussion about, branded products and brand new drugs and this and that. But there are generic drugs out there, and I hear people say all the time, I'm not sure about that generic. Should I, that my doctor told me to get Lipitor, and the pharmacist saying I should get a Torvastatin. Is that okay? Can you talk a little bit about generic and even how generics are approved? Why does the government let the generic happen versus the brand product? Because it's not just willy-nilly. It just come on the market.
Right. Well, so that's definitely a big time conversation to go through all the details. But basically what it is, and part of the reason why drugs are so expensive here in the United States, is because we develop them.
Yeah.
So we're doing, a lot of the companies that are American based are doing a lot of the development for the medications that are used around the world. And so we're doing a lot of that. And so because certain companies are creating these drugs, a lot of them life-saving medications, they have a patent on them. And so this patent, just like anything else, like the iPhone or whatever smartphone you have in your pocket, there's 1.5 million patents around that thing that are proprietary information. Well, the same thing is happening for your medication because of the sometimes millions of dollars of research that have gone into the teams developing it. There is a patent. And so that company basically gets the rights to that medication for an extended period of time, and can be 10 years, can be more, depends on how the situation works. So that's why you may see a patient or a medication out for a long time, and then it's been on the market for years and years and years, and all of a sudden you might get it in and it's got a different name on it, and you're like, well, I don't know how to say that name. Well, a lot of times, and your pharmacy will tell you too, it has gone generic. And so what that means is the patent has run out, and the opportunity now opens up for other companies, drug manufacturers, to take the directions that are available and create medication, and then create competition around the production of these medications. So that's typically what you see when the prices go down, is because there's more companies that now have competition to be able to make these medications.
And so they're just as good, right?
They do have the active ingredient, the same active ingredient. They have to meet certain requirements to make sure that this drug is doing the same thing that is required. There are some situations, very specific situations, where the brand is still needed, or a specific. So, for example, Synthroid, you hear about it all the time.
Yeah.
Doctors we'll see it on the prescription as a pharmacist, brand specific, or they'll specify either Synthroid or levothyroxine to make sure that's one in particular. So there's a small handful that we have to be very particular, brand versus generic. But for the most part, your generics are going to get you to the same end game, to the same goal. And so don't be afraid of the generic. Talk to your pharmacist and see. Some people just are very, very afraid and don't want to change. And I get it. I get the concern for your health. But we do 90% of what we are dispensing are generic medications in terms of the volume. But the brands are still, that's where that comes into play, is where they're at on their patent.
It also keeps that copay lower too. I think the other area now that I talked to a bunch of primary care physicians recently in June at this big conference, and one of the things that continues to blow up are what we call biologics. For those think about this, biologic are those drugs that work with our immune system and try to help us with a host of things, from rheumatoid arthritis to MS to Crohn's disease. I mean, they just keep growing, but there weren't any way for pharmacists to interchange those until recently, right, Patrick? So yeah, we're figuring that out now. There are now drugs coming out, or biologics coming out, that at the pharmacist level, you can now substitute a version that doesn't cost as much for a branded product, right?
Yes, yeah, and so and it's such a new area in terms of figuring out how this works. A lot of times, what we're struggling with is coverage for these medications, because even the ones that we're swapping out, insurance companies are still trying to figure out
Got it.
how do we want to cover these. And so a lot of times, so I'll take this moment to do a PSA. Your pharmacy is working as hard as it can to make sure that we're getting the right coverage for you. A lot of times people think we're just putting uh, pills in a bottle, or slapping a label on an expensive injection. But in reality, we're having to navigate insurance and make sure that the therapy's correct and there's no other drug interactions. So we're doing about 20 different things on the back end. And part of that is trying to figure out, with all of these new expensive medications in, what are our options? What are the ways that we can help navigate this for the patient?
It's, talking about this, there's a drug called Humira, and it's been around for a long, long time. I don't know if people realize or not, but this year alone, there'll be 14 biosimilars come out that work like Humira. And I can't even imagine how to navigate the insurance to figure out which one of the 14 they like. So you guys that work on the front line have a lot of background and work that you do to get people squared. So we've talked a lot about pricing today. You've given some really great tips. We've managed to talk about everything from copay to coupons to, being a good shopper, to knowing your budget. And so if you had to leave us with three kind of points of interest or three pearls of wisdom, what would you leave our listener with, what we've talked about today, to sum it up?
So I think probably the biggest thing is talk to your healthcare team. And so don't be afraid. You're not going to get a bad grade on if you're not doing everything 100% correct. That's the whole point for the team. A lot of times patients feel like they're letting their team down, letting their doctor down, letting their pharmacist down when they're not doing what they're supposed to be doing.
Yeah.
Our job is to help you navigate that. That's the whole point. So please be honest if you're experiencing side effects, or if you're concerned about copay, because I would not want to be, like I say, I work every day and I see some of these things go by and I wouldn't pay it. And so I want to make sure that we're providing the best options available. So talk to your team and let them know, because a lot of times these doctors don't know the copays that you're getting hit with.
That's a fair point.
They don't see that side of it. And so unless the pharmacy is sharing that, sometimes that triangle between patient, pharmacy, and provider, it's hard to get everybody on the same page. But when you do, a lot of great things can happen. So talk to your healthcare team. And then on the other side of that, I'd say the second thing is be cautious of who you're going with to try to, especially for Medicare Part D, be very thoughtful on who you're navigating that world with. Because you want to know, where are their intentions? What are they trying to do? Are your interests making sure that you're taken care of? Is that their interest? And so using someone, like I say, I'm personal. I like to use local. And so I want to know who I'm dealing with, no matter what is going on with me, because I know where their intentions are, and I want to make sure that they're taking care of me and my family. And then I think the last thing is don't let this get overwhelming to you. You're not in this alone. So don't just give up on it, because the side effects can be life altering if you just let it happen. And that's the big thing here is be educated, contact your insurance company and ask them there, when you have an insurance, even with a payer, if you work with if your employer is one providing insurance, talk to whoever it is at the company that's managing the insurance. We actually just recently switched our health insurance and prescription insurance. And so we're asking a lot of questions this year about coverage and how things work and navigating that world. So we have a contact person that we reach out to. Do the same for your employer and make sure that you know who it is that you need to be reached out. Don't just accept what comes to you without knowing what's truly going on.
I think those are wonderful. One of the things that I have heightened my awareness of is that, I work for an employer that has a plan, and I'm a pharmacist, and so hopefully I can help navigate this. But at the same point in time, if I were someone that worked in a different environment, lived in a different part of town, financially really, really had to budget hard and heavy, you should make sure that you look for your community resources and those folks that are out there to help you. And don't be afraid to ask people for those. I think your point about the middle one of choose people who have your interest at heart resounds with me, because I talk to a lot of people who, it's hard. Inflation's killing people, groceries are killing people. So your drugs are going up in price as well. So I love the fact you've talked about using your pharmacist, using local, talking to the AARP. Those are all things I love. Dr. Chancy, thanks so much for being with us. As always, you bring a wealth of knowledge. I love what you guys do with your family and your chain of pharmacies and all the services you bring to your clients and patients. Thank you so much.
Thanks, Tim. Appreciate the time, and always good to talk to a fellow dog.
I appreciate it, sir. And as we go away from this one, next month, I have Dr. Hannings coming on board. We're going to talk one more time about how vaccines work to prevent diseases and keep you healthy. And specifically, we're going to talk about the flu vaccine, COVID, and a brand new vaccine called RSV vaccine, anti. It keeps away a virus that can put you in the hospital as well. It goes along the same lines we talked about today. How to use your community pharmacist to keep yourself healthy. Dr. Chancy has led us down the path so we can be better consumers. Next month, we'll be talking about what we need to do to be preventive over the winter months to keep those nasty infections away, like the flu, COVID, and RSV. I'll talk with you guys soon. Until then, be safe, and thanks so much for listening to Farmcast from the Community from UGA.